Again, I'm Susan Aronson, and I direct the Dietetics program, and I would be your director whether or not you're in the MS or the MPH program. I did add to the chat just one more thing about applications because I've received a couple of these questions is if you're somebody who's very familiar with the path to become a registered dietitian, you know in the past that to be placed in a dietetic internship, there's a separate portal through the Academy of Nutrition and Dietetics that's called DICUS. That's the acronym for it. And there are some graduate programs like our own that are using the DICUS portal, but we are not this year. So if you go to DICUS, you will see that our program is listed, and there should be a note there that says we are only accepting applications for this cycle through SOFIS and Rackham. So I just wanted to point that out to everybody on this call who is here specifically because you think you want to apply to dietetics. So again, feel free throughout this next 20 minutes or so just to put questions in the chat. Carol and Keegan can answer them. And if it's something really specific, dietetics, they can bring it to my attention because I'm just going to be focusing on my slides, but there's also going to be an opportunity for questions at the end. So with that, I'm just going to move on. So this is just, even though it's just me here in terms of our program, I just wanted to show you that we have a really in addition to Carol and Keegan, we have a fantastic team that works to help guide all of our students through this program. Sarah is my counterpart, and she was actually in the in-person session on Saturday, so she's not here today, but she directs all of the dietetics training, which means she is responsible for making sure that you get those 1,000 supervised experiential learning hours and that we have the sites for you to go there. She also teaches some courses in our program. Amanda helps manage all of our data and is like a guru at communicating. So many of our communications come from her. And Erin is actually a graduate of our program, I believe from 2018, and we hired her about 4 or 5 months ago to be our clinical coordinator. She has a few years of experience in, acute care and clinical care in a variety of different settings, and she's going to help place you in those acute care clinical settings and then many of the outpatient settings where you'll get a variety of different experiences from perhaps cardiac rehab to diabetes care. So this is our team. And once you're a student here within our department, you'll get to know all of us really well. We do have monthly dietetics meetings that are mandatory, and each one of us lead the meeting in a variety of different ways, depending upon the skill set we're trying to get you to achieve. So obviously we don't have time to get to know everybody and for everybody to talk, but if you want to just add so that you can get to know each other as I'm talking, we already have your name, but maybe the hometown where you're from, and why do you want to become a registered dietitian? Because you are here to learn more about that. And there's a lot of different career pathways that you can pursue with the RDN, and it's kind of fun to see how everybody comes to this. So go ahead and take some time and add that to the chat, and I'll take a look at that once we get through the slides. Okay. So as I alluded to earlier in the presentation, that there are 3 components to dietetics education and 3 components specifically to our program here. There's lots of different ways to become a registered dietitian through the Academy of Nutrition and Dietetics, but we have what's called a graduate program, and I'll define that a little bit more in the future. So as you've already heard in the last session, you have to decide which degree pathway is right for you and make sure that you're in the concentration that allows you to be in dietetics and pursue the dietetics pathway. As part of our graduate program, you have to attain competency at various different levels. There are levels that you obtain competency in coursework, like at the nose level, where you're basically provided information and you can be assessed on various different exams so that you have a basic understanding. There's a competency that's attained at the shows level, where you can take that information and you can apply it to perhaps a case study. And then there's competencies that are achieved at the does level. And most of that happens when you're out doing your supervised experiential learning at all the various different sites where you'll be assigned. And I'll give you a little bit more detailed information on that. So you have your coursework, you have your supervised experiential learning. As I mentioned, you combine your degrees with your verification statement, and then you're ready to sit for the RDN exam. The exam, most of you would be taking, let's say you're going to be starting in 2025, you will be taking your exam in September or October of 2027. The beauty of our new program is that you actually can enter the workforce about 6 months earlier than what you could in the past, because we're integrating the internship or supervised experiential learning hours right into our coursework. So you don't have a separate application. You don't have to apply to a dietetic internship. You don't have to pause in case that internship doesn't start until September. It's just a continual educational process until you're ready to sit for the exam. This is something called, you might have seen this before in some of your previous education. It's called the Miller's Pyramid. And this is what I alluded to in the past slide of making sure that you are you attain competencies at these various different levels. And what's really beautiful about this new program is that you have many opportunities to achieve these competencies through a variety of different experiences. And let's say at any step along the way, you're not achieving the competency at the level that needs to, then we have remediation plans. We can give you additional experiences. If we see that you're weak in a particular area, we'll contact one of our RD preceptors for you to spend a little bit more time with them to strengthen your skills, because our goal is making sure that when you graduate from our program, that you will be a competent entry-level dietitian, and we'll help you on that journey, because we commit to, once you show up on our doorstep to become an RD, we really want you to be successful in achieving that in the 2 years that you're here. So just like we had a curriculum section in the past session, I just wanted to list for you, in addition to the 4 courses there that are nutritional science requirements that Dr. Cole mentioned and described in a little bit of detail, we also have dietetics requirements. So I have those courses listed here. You get a sense of where you're going to be concentrating a lot of your coursework time. And then in red, next to the courses that have supervised experiential learning along with them, I just wanted you to note that that's how we integrate it into the 4 semesters. You'll be taking courses for 4 semesters and then doing concentrated supervised experiential learning in the 2 summers. And I have a slide that breaks that down. I'm going to give you an example. If you look to Nutrition 635, that's a course that I co-teach with Patty Ramos, who was in our call. And it's a food service and culinary science course. And in that course, there's also 80 hours of supervised experiential learning that you'll complete. That's happening this semester. So what students are doing is they don't have any classes on Wednesday. So on Wednesday morning, they go to their food service site and they work in that site for 8 hours every Wednesday throughout the entire semester until they achieve roughly 80 hours in that. And what's really awesome about it is that they are learning right now food service techniques and some various different culinary science principles, and then they're able to apply those in those food service sites on the spot. So it's a really nice integrated application-based learning system. Okay, so those are our courses. And this is kind of what it looks like in terms of, I've mentioned a couple of times that in addition to the coursework, you have to have a 1,000 plus hours, minimum of 1,000. Some students will graduate with more than that, just depending upon, you know, perhaps extra rotations that they received. And this is a nice graph that shows you in terms of percentages, how the hours are broken up. So as you can see, the majority of your hours will be obtained in summer 1, which is our community clinical rotations. And in that, you might be in a WIC clinic, a women's, infant, and children's clinic. And, you know, there you're going to be working alongside an RD with young moms and their children up to the age of 5. You will also be in a skilled nursing facility. So that can be a rehab facility, a long-term care facility, a nursing home, and you'll be spending time in the skilled nursing facility along with an RD. And then a variety of outpatient clinics, just really depending upon your interest area. We'll ask you to complete a survey. We'll ask you where perhaps you might want to rotate in other parts of the state outside of Southeastern Michigan. We have a lot of out-of-state students. We had a student this past year who wanted to do some rotations in Texas and another in Chicago. So we help work with her to set some of those rotations up in other cities. It's really actually nice for us because it relieves our program of finding preceptors in the Southeastern Michigan area, which tends to be pretty saturated. Another bulk of your hours are going to be in summer too. So these are going to be the last things you do before you take your RD exam. This is where you're going to be inpatient acute care settings. We have 15 to 20 placements here at Michigan Medicine Hospital, and then a variety of different placements in Southeastern Michigan across the state. So you may be at any of these different rotations and sites, depending upon, the surveys that we ask, and where you might have opportunities to actually have family where you could stay with them in these different rotations. And then the hours that are integrated into coursework are listed here in the last two lines there. So both your nutrition counseling, like I mentioned in my presentation, and medical nutrition therapy have supervised experiential learning hours in them. I'm going to talk in a little bit about our nutrition counseling center, and that's where you'll get many of your hours in your medical nutrition therapy course. And then you'll also, as I mentioned, the food service and culinary science rotations that you'll do at various different food service sites. And we have students this semester. We have them on campus dining halls. We have them in school systems, both here in Ann Arbor and in surrounding communities. We have them at daycare centers, because daycare centers feed kids in mass, so in large quantities. And we also have some students that are actually at catering companies, a completely different way of showing food service. And they all have unique and interesting experiences. Similar, Dr. Cole teaches the community nutrition course. So in your final semester, again, 1 day per week, you'll go out and you'll rotate through a community center as you're taking that course. And then we have a new course that we're offering in leadership and management. And you're going to have some opportunities to complete a management project during that time and earn some supervised experiential learning hours. So this is kind of the bulk. I mentioned the elective series that you can pursue. Again, that might be somebody who's interested in learning more about disordered eating, and you do some rotations at an eating disorder clinic, or it might be somebody who's interested in sports nutrition, and you're going to work with our performance nutrition team here at the University of Michigan in their Olympic sports and in their football-oriented sports. So lots of great opportunities, and we have literally dozens and dozens and dozens of preceptors in the community that we've worked with in the past where we can place you. I'll pause there.
Susan,
Yeah.
I had a question, and I've been busy in the chat, but can you talk about, do students have to secure a preceptor for their SEL hours?
Right. Sorry, I just had a piece of gum in my mouth.
Oh.
No. So we will secure your preceptors for you, with the exception of if you perhaps wanted to be in another state closer to home and we don't have a contact there or an alumni there, we would ask that you start to kind of search out. Let's say you want to be in Houston, Texas, and in Houston, Texas, you want to get your acute care rotation and you happen to know a dietitian who works there, so you might start that process. We would at some point chime in to help create an affiliation agreement, which is something we need to have with any precepting site. But in general, like all of these hours that I'm telling you about here, we help find those. So Sarah Ball goes out and she finds, for this first year cohort, we have 43 students in it. She has 43 different food service rotations, and then you are assigned to that rotation and you complete it during this semester. Same kind of thing right now. We had a meeting today and she already has over 40 rotations for community, and we'll assign you to that. It's definitely challenging to get acute care. These clinical rotations are challenging, so we're trying to do as many creative things as possible to make sure that everybody gets a really high quality rotation. Does that help? Okay. I think you're muted. Mute,
Oh,
Carol.
I am. Okay. Yeah. Another
Okay.
question. Are there any SEL opportunities with Michigan athletics?
Yes. Yeah. So in fact, just this morning at 9 o'clock, I met with one of the RDs who is a performance nutrition dietitian. And he's working with 6 of our students right now, 4 second years and 2 first years. And they volunteered their first semester, and then second semester were hired in. So they've been accumulating hours throughout the whole time that they're students here. In the past, we've had our old interns do like 2-week rotations with sports nutrition. We're trying to determine what that new relationship might be. One of our former students is also at Eastern Michigan University, which is a neighboring college in the town, just 10 minutes down the road. And she takes some of our students also. I have students right now that are reaching out to the professional teams in the area. We're working on an agreement with the Detroit Lions. We have somebody who's perhaps might be able to work with somebody at the Denver Broncos, somebody else that we have some connections with the Detroit Red Wings, which is a hockey team. We can't guarantee any of these, but we are always trying to form new partnerships.
Okay, thanks, Susan. I have another question. If a student is working part-time in one of these areas, can it be contributed to their hours? Example, WIC clinic, clinical setting, etc.
Strongly possible, yes. So we need you to just, if it's a WIC clinic, it's a no-brainer as long as you're working alongside a registered dietitian. We don't want you to repeat experiences. We want you to gain new experiences. So I have a student, a second-year student who's been working for the Department of Education, Health and Human Services, because she had this job right after undergrad, and she's getting some hours for that. So we definitely will work with you so that your current jobs and experiences can count for some of these SEL hours, but we also want to make sure that you're exposed to all of these different areas so that you have the knowledge to pass your exam. Any other questions, Carol?
Lots of questions.
Want me to go through the rest of the slides and then I can pull them up and answer them?
Yeah. I
Only,
mean, I can, yeah, you keep doing the slides. Go ahead.
okay. All right, sure. So just to give you an idea, when I talk about like this continuum and these different competencies, this is just what it looks like. And, we also kind of call it a scaffolded approach where one builds on another. So in nutrition counseling, you're going to learn about motivational interviewing, and you're going to do that, like I mentioned, in a really safe environment with peers, other students in your cohort who are pursuing the path to become a registered dietitian. Then the next semester, you're going to take medical nutrition therapy, and you're going to do some case studies. And in those case studies, you're going to take that knowledge application and deepen it a little bit. And then in that also semester, you're going to get real live clients who are undergraduate and graduate students with basic nutrition questions and needs that you'll be counseling along with one of us who's an RD preceptor in an online session. So you really get some experience in practicing that MI with somebody where the answers aren't always predictable, or it may pivot in a different direction, and you're going to have to like kind of go into your brain and pull some of the information that you've already learned and regurgitate that out, and really just kind of go through the process of real patients. So that's kind of how we apply these knows, shows, and does competencies in a variety of different settings. And we'll obviously, as the program progresses and you're here at the university, we'll help you navigate that.
I have a question.
Sure.
Yeah. So this may be funny, but what is the best way to explain maybe to a fifth grader what exactly is dietetics?
Oh, that's a really good question. We do a lot of outreach out into the community and work with students at all different levels. We had a fun high school program this past year. So at a fifth grade level, Carol and I used to teach at a sixth grade level. So I would say like a dietitian, if you're explaining to a fifth grade, a dietitian is somebody with specialized education that teaches you how to make the best and healthiest choices in the foods that you eat throughout the day to make your body strong and function for all the things that you want it to do. That's just an off-the-cuff answer. I could probably come up with a bunch of other things.
Yeah, that's interesting. I was just thinking all over to say, like, sometimes how do you, in the field of dietetics, how would you teach maybe kids at that level to really understand what dietetics is all about.
Yeah, I mean, obviously dietitians are people who help people with a lot of various different disease states understand their diseases and how foods can impact the outcome. That's kind of a little more complicated. But also sometimes it's helpful to teach children from experiences that they know in their own family. Like, oh, my grandma, yeah, she has that diabetes, and this is what, she needs to do. And then you can explain to them like how foods and helping her, make choices can impact the quality of her life too. So we talk a lot about quality of life.
Okay,
So
thank
I
you.
have, yeah, you're welcome. I have this slide in here just to kind of show you again, like when we say that we have the scaffolded learning approach, it's just like you build your base through coursework and you build your base through safe experiences. And then as you get more confidence, you feel more confident that you can share those skills outside of your comfort zone. So that's what our new program really attempts to do. And we've carefully kind of curated and organized the coursework in a sequential way so that your skills do build upon each other. So you're really ready to go out into the community and acute care and clinical settings once you have the knowledge that you've obtained that. So, the last thing that I think I want to mention here before we take the last few minutes of questions is that we do have this fabulous nutrition counseling center. This started a couple of years ago when faculty and students from the School of Music, Theater, and Dance here at the university reached out because they wanted our students to provide them with cooking classes and various different lectures and workshops on eating. And so what we decided is it would be a really nice opportunity for our students one-on-one to work with students across the university, completely free, who've got a variety of different nutrition questions, and that they could practice their skills. So last year in our winter semester, when we had our first semester of medical nutrition therapy, we saw about 120 University of Michigan students. So each of our dietetic students had at least 2 full counseling and some follow-up appointments with undergrad and graduate students from a variety of different schools and colleges across campus. And basically, these were some of the topics that our students were able to practice with, like meal planning, healthy eating, students that are working out at some of the athletic facilities and they want to know how they can fuel themselves for more energy, to be more efficient in their workouts. General nutrition plans. We bring up My Plate and we explain My Plate to the students quite a bit. A lot of students are really struggling. They're eating on a budget. So can we give them some tips on how they can shop, get the most bang for their buck, and have like a really nutritious meal too? So we have a lot of fun in these sessions. They're stressful, but they're also exciting. And students always feel like they've accomplished something when they're done. And you have the safety of having one of us who are already RDs and have a lot of counseling experience in there to save you when needed. And we have like a whole conversation that's worked out in case one of the students is struggling and can't find an answer, that will jump in and help. And the nice thing about it is the U of M students, they're all learning too. They might be coming from different allied health backgrounds. It could be nursing students or pharmacy students or medical students. So they know what it's like to go into like clinical settings and learn something completely new and be uncomfortable. So they're great patients or clients to have because they're just so kind and generous and patient, I would say. So we love that we have this new center and it continues to grow. And as a student here, you will start counseling other U of M students in your second semester. If you're somebody who already has a verification statement, because we do have a handful of students that come in that have done an undergraduate program, you might be exempt from some of your coursework and you might have the confidence to start in the counseling center in your first semester, and we allow you to do that. And I think that's all I have. So why don't we take the next couple of minutes to answer
Yeah.
any additional questions that you have. And I can also pull up the chat if that's helpful, Carol. I don't know.
Yeah, I mean, I've been answering them, but one of them that just came in was about if you have a DPD statement.
Uh-huh.
If you want to just, I mean, you elaborated on
Yeah.
that.
So I think in our first year cohort, we had about 8 to 10. In our second year cohort, about 8 students. that came in and they did undergraduate dietetics. So from their DPD director, they have a verification statement already. And so what does that allow you to do? It allows you to get exempt out of coursework so that you don't have to repeat it. And we have forms that you'll fill out once you become a student here. It allows you to jump into some opportunities a little bit sooner. It doesn't allow you to eliminate any of your supervised experiential learning, because if you're coming in with that, you haven't done an internship. So you need to get all of your supervised experiential learning hours in. And if we find that you took a course that you either didn't do as well as we would have liked on, or the content was a little inferior, we may ask you to take it again. But you can also just sit in on it and you can audit it too, or we could give you access to the course site so that you have the material. So we really like working with students who have DPD verification statements, but it is not a requirement to come into the program, but you are welcome. And we have some pretty good experience knowing what works best too. And then, so how do you get, there was a question about the DPD verification statement. I don't know if that was actually the question. If you went to an undergraduate dietetics program, you know what it is. If you didn't, then you don't have any worries. You don't have to get one of those. And another thing to note is even if you did go to an undergraduate dietetics program and you have a verification statement, I'm still going to give you one for your graduate program so that you can sit for the exam, because that will only get you into a dietetic internship, the DPD verification statement. But when you complete our program and all the supervised experiential learning hours, you get the statement from me that says that you can sit for the exam. So everybody who's in dietetics will get that when they're done, after August of their second year.
Hey, it's 5:30, Susan.
Oh, I have a question, maybe a
I'm,
different one.
Yeah.
yes, go
Lori.
right ahead.
Yeah, you said something about the career interview in the uh, chat section, and there you said that the career interview is for students who are pursuing the dietetics path. So my question is, this career interview, do you take it before being admitted or after you're already admitted and now you have decided that you're going to go for the dietetics? Or where do you make that decision that, for example, I'm in the MPH program, where do I make the decision that I'll go for dietetics? Is it when I'm already in the program or before I'm even enrolled in the program?
Yeah. So, can you still hear me? Because my computer's doing something wonky now.
Yes, I can.
Okay, I'm going to stop sharing because it wants me to update. Okay.
Susan, do you want me to answer that?
Yeah, go ahead. I mean, I
Yeah.
actually, as long as you guys can see me, I'm fine. We really need you like by the first drop ad deadline of the semester to determine whether or not you do or don't want to be in dietetics, and preferably at the application process.
Yeah.
Because if you want to be in dietetics, once again, you have to do your Kira interview. So
Yes.
the requirement, and we are only accredited for a certain number of students in every cohort. And so we need to make sure that we also have room for you.
Yeah. So
Yes.
just to kind of follow up with what Susan's saying. So if a student is MPH dietetics, they cannot submit their application until they have completed their Kira interview. So we cannot even see your application until that interview is complete. Whereas if you're more interested in MPH nutritional sciences and not dietetics, then you do not complete the Kira interview. So hopefully that there's some distinction between those two.
I also want to say for the Kira interview, like this is not anything to stress about, and you can't prepare for it. So we're not going to be asking you clinical questions, in-depth dietetics questions, testing your knowledge on micro and macronutrients. We're just going to ask you random questions, that you should be able to think on the spot and answer with that 30-second preparation time. It might be the same kind of questions that you might get if you're, going out to dinner with a friend who just moved to the town where you live, something like that. So So please don't procrastinate doing this very, very short interview because it's going to delay the submission of your application. I think that you'll hopefully find it relatively stress-free. And again, it's just one part of this very holistic application process that we have. Any other questions? Feel free to send me an email with, I'm happy to hop on a separate Zoom if you've got some really unique things that you're thinking about in the future, or just answer questions via email. Happy to do that at any time.
Hello.
Is there another question?
Yeah, hello.
Hi.
Yeah, please, can we get your email address in the chat box or?
Oh, yeah, Carol just put it in. Looks like that maybe that's it, Carol. Is the acceptance?
Hello.
Yes.
Yeah, okay. I wanted to also ask that I'm Esther from Ghana, okay, and I have public health nutrition as my undergrad. So can I apply for dietetics as my master's program? And what are the requirements? Do I also need a clear interview? And I just want to know, have an overview of how I can apply and the things that are required for the application. Thank you.
Is that for did you say for the MS application?
Yes, please.
Yes. So were you here for the first part of the presentation when we talked about applying through Rackham?
No, please. I just joined when they were on the questions and answers, so I
Okay.
joined.
You know what I would suggest then, why don't you send me a separate email and I can go over that via email. The other thing that might be really helpful is when you get the recording from the first hour, we went into that in pretty good detail, but we'd also be happy to answer it one-on-one via email with you.
Okay, please. Then please, I would like to see the email address in the comment section.
So it is actually, my email is there. Carol Durgy at 5:34 p.m. Put it in the chat. I'm Susan Aronson. And there's a question there about the acceptance rate. Yes, similar. But again, we do have, each cohort is accredited for 40 spots, and we have filled the last 2 years. So I would just encourage you to get your application in as soon as possible.
Okay, so I think thanks for coming, everybody. And there was a question about the recording. You will receive a copy of the recording and also of the slides, so you can go back and review all of that information. And as Susan said, you can reach out to Susan, myself, or Keegan with any questions. We're here to help you through this process and, making some big decisions. So let us know how we can help. And we're really happy that so many of you were here this evening. Thank you. Okay, and Lindsay had a one last question. So our admissions is not, well, I'll give you some dates. So December 1st is kind of our priority deadline. It doesn't mean that you have to have your application in by that time, but we encourage you for the MPH and MS to get it in by December 1st. With that being said, you can actually submit your application until May 15th. International students must submit their application by January 15th. We encourage you to submit your application early because everyone is considered for a scholarship based on merit and need. And if you submit your application in late March, we don't know how much scholarship money we will have left. So the admissions committee will start reviewing the MS and the MPH applications in January and February. And so it just means that if you get your application in Rackham and Sophus, they have to make sure that everything is complete before we can see it. So we encourage you to get it in earlier than later. So hopefully that helps. But don't stress if you don't have to have it in by December 1st. So anything else? Okay. All right. Well, thanks again, everybody.
Hello.
Thank you.
Yeah, please. It's like I missed the email address. I wanted to say, but I can't find it in the chat box again.
My email address, I can put it in again.
Yes.
I'm going to put it
Okay. Okay.
right
Thank you.
now. Actually, Carol, I can't. My computer's doing something wonky again. Can you add it again?
Yep.
My computer.
Okay. I just did mine. And then I'll do Susan's, and Keegan's she's done hers as well. All right. Okay. Well, everybody enjoy wherever you are your evening or morning, and we'll connect again soon. So thank you.